Hello, everybody. I'm Bill Press. I'm the Leslie Surgener Professor of Computer Science and Integrative Biology at the University of Texas at Austin. I'm also the elected treasurer of the National Academy of Sciences. This is the second panel presentation today. Our panel is about response to the pandemic, and we're very pleased to have here both scientists who helped respond and also Mayor Jenny Durkan, the mayor of Seattle, who will have many interesting things to say as someone actually making the decisions about what to do. Our format is similar to the last panel, except that we've asked these panelists not to show slides in their initial 5-minute presentations. We want to have more of a presentation with give and take, and of course we'll have the long discussion and question period afterwards. The other opening remark I should make is I'm going to keep my introductions of the speakers very, very brief, basically just saying what their current affiliations are. And the reason is if you're watching through the NAS website, you're just one click away from seeing their long and very interesting, in all cases, bios. In fact, if you find that link to click, my advice is to right-click it and open it in a new tab so that you can go back and forth between, so that you can listen to our discussion and at the same time, if you wish, multicast by reading their bios. So with that very brief introduction, the first speaker who will give a 5-minute kickoff is Dr. Nicole Lurie. Dr. Nicole Lurie, Nikki, is Strategic Advisor to the CEO and Response Lead for the Coalition for Epidemic Preparedness Innovations, CEPI. She's also a senior lecturer at the Harvard Medical School. I think more interesting and more relevant to our participation today is that during the Obama administration for 8 years, she was Assistant Secretary at Health and Human Services, responsible for preparedness and response. So she was not in government, of course, during the Trump administration, but she was in a very unique position to observe things on the national scene. And with that, Nikki, please.
Good. Thanks so much, Bill, and hi to all of you. Hope your Zoom fatigue isn't too great. So I'll just start by saying, as I think about strategic leadership here, the US had been planning for this kind of a pandemic for decades. We all know there was a lot in place. There was a playbook that should have enabled a different response for us and a different kind of strategic leadership. States and local governments have also planned for this for years. And at that level, it's stunning to see and to have seen such examples of exemplary strategic leadership, I think, in contrast to what we saw at the federal level. So the glass there is really very full, not even half full in my own mind. In my recorded talk, I outlined my perspective on a number of things that I think should have happened at a strategic or tactical level that did not. I wanted to touch on a few of those issues for the federal response here in the hope of stimulating, I think, some good conversation. So particularly from my perspective, having served as Assistant Secretary for Preparedness and Response, one of the responsibilities of government is really to prepare for the worst. You can always hope it doesn't happen. You can always scale back if it doesn't happen. But your job is to protect the American people from harms and to build resilience if the worst things happen. And so I think that there are a handful of areas that I want to highlight today where strategic leadership plays a really important role. The first of those, I think, is dealing with uncertainty and dealing with bad news. And as this pandemic unfolded and we had the early warnings a year ago, December, and then into early January, good strategic leadership would have done a couple of things. It would have done some scenario planning to look at all the possible ways this could evolve and plan for them. It would have gotten the public ready for those various kinds of contingencies, and in doing so would have served a terrific preparedness function for state and local government, for the healthcare system, for the private sector, for the public in general. And so thinking about how as a strategic leader one deals with uncertainty, and bad news is terribly important, and also how it is that you communicate that to the public. So understanding that that's the situation, also understanding the need is my second item to gain and retain public trust through a crisis is absolutely critical. And so that encompasses all of the communication strategies that I think we all know about at this point in terms of communicating clearly and consistently from the top, et cetera. And also, frankly, in the early stages, priming and educating networks of communicators around the country and around the world to carry those messages in a way that maintains confidence in government and in a really strategic way. A third strategic area that I would want to point to is eliminating single points of failure early. And I think we saw a terrific example of that in vaccine development when it ultimately got going, in that the federal government invested in multiple vaccine candidates because vaccine development is so risky. And it's been terrific to see so many of those candidates come forward and be successful. In contrast, we had a huge single point of failure when it came to diagnostics and diagnostic tests, with the failure of diagnostics development at the CDC and no real plan to go to the private sector and scale early. So eliminating those single points of failure as a strategic leader, terribly, terribly important. Thinking about equity from the very beginning is another important strategic choice. In every single disaster and crisis that we have ever had, and certainly any that I've dealt with, it is always underserved, disadvantaged populations of one kind or another, whether they're low income, low education, people of color, et cetera, people in harm's way in one way or another. So thinking about that from the beginning as a strategic choice, why they might be vulnerable, how to eliminate those vulnerabilities, not as an afterthought. From a perspective of all of us at NAS, setting a research agenda, particularly when you're dealing with the unknown and doing that early, terribly important. And the final strategic choice I want to talk about is thinking about the global implications of your actions early. I want to shift for a minute to asking a couple of questions. I think as I look at so many aspects of the failed federal response, one of the things I'm so struck with is asking myself what kept really capable, competent senior officials from acting. And my observation has been that an atmosphere of fear and intimidation really permeated the science agencies and other parts of the administration, not just HHS, but others, leading to tremendous interference with science and lots of fears of people being able to stand up and speak out. So that once leads me to want to leave you then in my 5 minutes with a question for you, which is how, what as a scientific community is our strategic leadership opportunity and our obligation now? One of the things I feel strongly we need to do as a scientific community is think about how to protect the integrity of science and science agencies in the future and make it safe for scientists to do their job and speak out. But also to ask, what does preparedness for us as a scientific community look like, not tactically or operationally, but strategically? And what leadership choices do we all need to make now? Thank you.
Thank you very much. So I'm going to turn next to Mayor Jenny Durkan. Mayor Durkan is the 56th mayor of Seattle, and she became the city's first female mayor since the 1920s. I think there must be an interesting piece of history back then. And its second openly LGBT elected mayor. She took office in November 2017. We just heard from Dr. Lurie what might have happened but didn't at the national level. In fact, the national level proved, as we all know, to be entirely disorganized. So the baton fell really to our local, state, and local officials, of whom Mayor Durkan was really a shining example, and Seattle emerged as a great success story. So Mayor Durkan, what would you like to open with for us?
Thank you, Bill. It is really an honor to be here. And I want to thank the Academy for having me, and it's a very unique gathering of the Academy. This last year has been such a remarkable time, and perhaps one of the most sustained challenges that any of us have ever seen. For scientists, I know it was an unprecedented experience to actually live through a global pandemic and test on the ground all the theories that people have studied over 100 years and develop new theories to test those. I think as history is written, there will be many lessons. And the one I hope to contribute today is to better understand the necessary and important connections between public health officials, scientists and researchers, and elected political leaders. I think in the last year, we saw that when these links failed, our response to the pandemic was at its weakest. And when these links were the strongest, our response to the pandemic was in its strongest. As anathema as politics is to science, politics with a small p is critical in a successful response to a global pandemic. In the earliest days, the scientific public health system failed us. And that is, as we just heard, is mostly because of the testing. The failure of the testing regime and capabilities left all of us blind to the growing danger. And these early failures that left us blind really cast the die for the first weeks of the pandemic. But I think as the pandemic grew, we saw in graphic detail that the politics and not the science of the nation, the world, the region, or the cities, when it failed, we faltered. Seattle and the area was among the first in the country to experience the COVID-19 cases, hospitalizations, and deaths. We were one of the first cities to take bold action to curb the spread of the virus. And now, a year later, I believe we will be one of the first cities in the nation to reach a community immunity threshold by vaccinating enough of eligible individuals. Right now, we have the lowest number of cases and hospitalizations of any of the 30 major cities in America. But that is only because of the unified actions of our elected leaders, the actions of our residents, and because we have some of the foremost accomplished healthcare providers, labs, researchers, and scientists. But it's also because we elected leaders wed ourselves to those scientists and researchers, and we're willing to take bold actions at the beginning of the pandemic. We know that the only way to return to some semblance of normal is through vaccinations. And again, I think that we have to follow and listen to and promote the public health officials. Looking back 10, 20, or 50 years from now, I think we'll remember the sorrow and loss of this time. But I hope we collectively can also remember that when we did these works together, it was through bold action based on science that we actually were able to take actions that were unprecedented in this unprecedented time. Back then at the beginning, this whole crisis, we had no national playbook. And as we just heard, no national leadership. That left it to us, local officials, to actually write it as we want. If you'll remember the initial days, it almost seems rudimentary, where we're talking about non-pharmaceutical interventions and started quickly moving the dial through all of our playbook. Here in Seattle, we had a tabletop exercise with my whole government when we learned about the epidemic in China, and we knew it would come here. But at that time, public health thought we had nothing to worry about because of the testing failures. And on February 28th, a Friday in the evening, I got the call saying we had our first deaths and hospitalizations in the area that have been attributed to COVID. We then government moved at unprecedented speed for government. But we were able to do so because we as elected leaders, the governor, the county executive, myself, and the leaders from the adjoining counties all got together in a room to decide how we could communicate to the public a unified message. By March 3rd, just days after we'd learned of the deaths, I was able to declare a public emergency. We were able to speak to the large employers within days of learning the information ourselves, and they were able to start moving their employees to work from home within the week. The data now clearly shows that was critical to us flattening the curve. And we in government had to do the same thing. We moved towards getting our employees working from home. And also realizing that we were going to have so many small businesses fail, our schools would close, that we had to turn the dial for government to provide services in ways we'd never done before. We started out turning that dial, but we had to do it very quickly. And it was only because of the scientists and researchers who, in the absence of the testing data that we would have needed to really see how big the epidemic was here, those researchers were able to guide us because we had what was called the Seattle flu study. I can't say enough about the work that they did. They went back and retested swabs and were able to determine that, yes, COVID had been here in our region for a while, and start doing some modeling based on genetic research they were doing of the virus itself. And it was one of the most sobering moments I've had in my whole life, and the most sobering moment perhaps in my time as mayor, because it was clear from the modeling that if we did not take bold action, we would have over 70,000 cases in a matter of weeks because the exponential growth was so great. You have to remember, governors, mayors, elected officials, we spend a lot of our time promoting the businesses in our community, drawing new jobs, having vibrant downtowns and restaurants and nightlife. We build that kind of urban place that is so important to us. And the only way that we could fight this virus was to shut that all down. And I think that that was one of the hardest decisions that any of us as elected officials, but because we were ground ourselves so early and so quickly in the public health data, in the pandemic research that we knew was there, and in what the scientists were telling us, it really was the only choice that we had. I think it shows that in those challenges, in those moments of crisis, that the World Health Organization was exactly right. That elected leaders needed to speak with one voice. So we made sure that the governor and the mayors and the executives were in a room. There was a lot of debate and disagreement on issues because we had no playbook and we were flying blind. But we had to trust the science, and we saw in other places of the globe what was happening. And so we had to move quickly, and I think that that was the right thing to do. We have seen this same thing play out, and I think that we will have a fascinating way to look back at comparing those local jurisdictions that resisted the science with those that were wed to the science, and how their different cities both made it through this epidemic, but also how quickly they could recover. There will be 1 million case studies coming out of this time in history, but I think one is absolutely clear, is that we need both the political leadership and we need up-to-date scientific research capabilities, but we need it at a national and global level because the pandemic, being a global pandemic, we learned, I think, more quickly than in any other time how tied we are to other regions. So I'm very much looking forward to this panel and to some questions from the audience.
Thanks. Very, very interesting. And in fact, let me emphasize to the audience that if you go to the NAS webpage interface to this, I think that's not the same as if you're directly on the YouTube interface. You can ask questions right there and they'll be conveyed to us on the panel. Mayor Durkan described how she dealt with the rich scientific resources in her region. Let's go through the mirror now to a researcher on the other side of that equation. Professor Lauren Meyers is the Cooley Centennial Professor at the University of Texas at Austin. She was the founding chair here of the Department of Statistics and Data Sciences. And she and her lab have pioneered the application of data-driven models and machine learning to improve the detection, surveillance, forecasting, and control of emerging viral threats. Lauren, what can you tell us?
Well, thanks so much. First, let me say what an honor it is for me to serve on a panel with these three brilliant and effective leaders who have really stood up as the adults in the room, guiding our cities and our country through this really traumatic period. So as Dr. Press said, I've been modeling epidemics for a long time, for decades, during crises like SARS and H1N1, Ebola, Zika, COVID. Modelers like me have pursued answers to three basic questions. Where and how is the pathogen threat spreading today? Where will it be in the weeks and the months ahead? And how should we use costly measures and limited resources to slow spread to save lives? In other words, we model to understand the threat, to forecast the threat, and to mitigate the threat. And I'd like to highlight just three of the points that I made in my recorded remarks. First, we should have and could have had a data-driven framework for a coordinated and effective response to COVID across the United States at many different scales. As a proof of concept, after the 2009 H1N1 pandemic, my team worked closely with the state of Texas to build online decision support tools that would help with tabletop planning exercises, stockpiling of ventilators in preparation for future threats, pharmacy-based distributions of diagnostics and drugs, and vaccine distributions to ensure fairness, equity, effectiveness across the state. So these were challenges that we're facing today that we anticipated a decade ago. And these tools that we built would have potentially saved lives, yet they were shelved by the state agency as our memory and sense of urgency faded after 2009 and as the funding for these kinds of initiatives disappeared. So going forward, we must make sustainable investments in the science and the practice of pathogen preparedness at all different scales. The second point I'd like to make is in relationship to our ongoing modeling efforts that Dr. Press mentioned to support COVID responses in the city of Austin, Texas. The metropolitan area is about 2.2 million and growing very quickly. It's where I live. And Austin, like Seattle, is a great model of city leadership working with all stakeholders, as well as scientists, to make effective decisions on a day-by-day, week-by-week basis, and really working hard to cultivate community buy-in to those decisions. To my knowledge, Austin is one of the very few cities to clearly and consistently follow a color-coded COVID alert system for almost an entire year. This system was carefully designed by the leadership and the scientists to achieve very specific and intuitive public health and socioeconomic goals. It has also been instrumental in tackling two of the responsibilities that Dr. Lurie just mentioned, dealing with uncertainty and gaining and retaining public trust. So far, this alert system has been invaluable to achieving all of those goals in the city of Austin. Austin effectively socialized the policy, and I mean the leadership socialized the policy through press appearances, social media, and by developing and maintaining a simple public-facing dashboard that tracks the key data used to trigger changes in our color code alert stage. And they have thoughtfully guided the city every single time we've actually had to make a change and either relax measures or make them tighter. So my third and final point is really echoing what I heard the other speakers say in their recorded remarks. Dr. Rivers urged us to take, to hopefully soon be able to take a period of reflection. And I just echo that this is an essential point in time for us to build a robust national resource in pandemic science, data, and modeling with direct bridges to policy and public health at all scales, from local to global. And I also echo Dr. Lurie, who urges us to develop and execute a real-time research agenda for dealing with the unknown. We cannot, again, fall into the trap of looking backwards and assuming that future pathogen threats are going to look like influenza or COVID or the viruses and pathogens that we're familiar with. It is imperative that we take a deliberate and scientific approach to overcoming our collective failure of imagination. And I look forward to the discussion. Thank you.
Thank you. Finally, let me turn to Professor Caitlin Rivers. Professor Rivers is a senior scholar at the Johns Hopkins Center for Health Security, and she's an assistant professor in the Department of Environmental Health and Engineering at Johns Hopkins, at the Bloomberg School of Public Health there. Dr. Rivers' research focuses on improving public health preparedness and response, and she's been especially vocal in trying to look to what changes are needed in federal policy or the organization of federal agencies in light of the pandemic. Dr. Rivers?
Thanks. It's an honor to be here with you all today. I'm excited to join you. And we've heard from several of my colleagues the importance of bringing to bear science and particularly data and modeling to questions of outbreak preparedness and response. And so that is what I would like to highlight today. I think this idea of using public health data and analytics is really central to improving our public health capabilities. It's really what epidemiology is founded on, and I see so much room to grow yet in the field. The first overarching point I would like to make is that outbreaks happen way more often than people realize. It's true that COVID is a once in a century event, but it's about every 2 years that we have serious crises that rise to the level of threatening our national security. From SARS in 2003 to H1N1 in 2009, more recently, COVID, Zika, Ebola, we face these major threats all of the time. And they're not just detrimental to human health and life, they also disrupt economic activity. And so there are many good reasons why we need to prioritize preparing for pandemics as one of our central capabilities. Now, what can we do? Often people think first of medical countermeasures, vaccines and drugs when they think of the kinds of things we should have on the shelf for crises. And it's true, I think vaccines are probably one of humanity's greatest achievements. And we should continue to bring to bear every resource that we can to expedite the development of vaccines and to develop therapeutics and to distribute them to every corner of the globe. But that cannot be the only tool in our toolkit. Even when we are fairly well positioned to be able to develop and deploy a vaccine, it can still take months and months and months to really bring that into the crisis. Ebola in 2014, for example, there were years of investments in R&D, and so there were several products nearly ready for clinical trials when the outbreak hit. And even still, it took most of a year to be able to begin those clinical trials. And during that year, it was through non-pharmaceutical interventions, the distancing, isolation, quarantine, contact tracing, that had already really brought the epidemic under control. We see with COVID too, it has been an absolute miracle year of science with the development of vaccines in under a year. But even still, it was a year, and a lot of unfortunately, many people lost their lives in that year. And so vaccines and drugs cannot be the only tool that we reach for. I think we need more innovation. I think epidemiology is built on data and data science, but we have not been prioritizing that for investment in the same way as we have medical countermeasures. And I think that for me is where data and modeling come in. There's so much we can do to bring modeling to bear to support public health response. We heard from Dr. Meyers a few things that modeling can do to help support that decision-making cycle. Just to highlight some of those uses, forecasts, or the expected future number of cases, is one of the most common modeling products during an outbreak. And we can use those to anticipate what is going to happen in the future with the outbreak. Is it going to get worse? Is it going to get worse in one region relative to another? Where should we send interventions, and how should we plan our intervention resources, which are often quite limited when you're responding to an outbreak? Another common modeling product is testing various interventions to see what expected response, what expected outcome they will have on the outbreak, and to compare different interventions, which might be more effective and how should they be prioritized. I want to make the point too that there are a lot of parallels drawn between disease modeling and weather forecasting, and I'm a proponent of drawing those parallels because I think it helps people really understand the possible trajectory of the field. One thing I like to note though is that with weather forecasting, it was really not until the weather forecasts had come into a good cadence and were produced regularly and were accurate and reliable that we found uses for them. Originally, it was primarily about commercial activity, cargo ships, aviation, that were the primary consumers of forecasts. But once we got forecasting to the level that we enjoy today, we found all sorts of ways to use it and to understand it in our everyday lives, from planning to bring an umbrella to planning an activity at the park or indoors. And I think we can expect a similar trajectory of disease forecasting. We can imagine important uses for how we might be able to use those products now, but it's not until we really have them at hand that we will find the whole suite of uses. Right now in the US, there's a robust community of academics who volunteer their expertise in infectious disease modeling and analytics to support outbreak response. And I think it's such an incredible resource that we have. And it's really through the generosity and expertise of those academics that we have been able to power the US response. But I don't think we can carry on like that. That's not how we do national defense. That's not how we do weather forecasting. We have institutions that we fund and that we keep standing at the ready so that when a crisis hits, we are prepared to respond. And I think that's where we need to go with infectious disease modeling and analytics. And that's why I am so excited that the Biden-Harris administration announced on the first full day in office the intention to create a National Center for Epidemic Forecasting and Outbreak Analytics, which is very close to this idea of a National Weather Service, but for infectious disease forecasting. There's also a substantial amount of money in the American Rescue Plan to fund these activities. And so although the administration has their hands full with dealing with the crisis at hand, I'm very excited by their vision and their intention to push forward with creating this kind of institution. Happy to talk about that more in the Q&A, but just to close, after every crisis, and particularly every infectious disease emergency, there is a period of reflection where we try to understand what went wrong and what we need to do better next time. And that's because we know that there will be a next time, there always is, and it's true there will be another outbreak or another pandemic that we need to face. And I think that it is in our strategic national interest to be ready. And I think keeping outbreak forecasting and analytics at the ready is one of the key tools that we can have to be prepared for that next eventuality.
Thank you. I guess I'll exercise the moderator's prerogative and ask one or two initial questions. Mayor Durkan, we heard how you very quickly decided to follow the best scientific advice and were able to sort out what in your mind and the mind of your administration was the best scientific advice. We also heard from Dr. Meyers a pretty good news story about how Austin, the city, did it. On the other hand, I know from having talked to Lauren previously, her story about how our state elected officials here in Texas were willing or not willing to accept scientific advice would be a very different story. So I'm interested from your point of view as someone right on the firing line, what was your previous relationship with scientists or understanding of your local institutions? What made you willing to jump in and follow the advice of a bunch of research scientists who happen to be in your area?
So that's a great question. You know, I've had strong relationships with some of our great research labs. I had recently myself had cancer, and so had strong ties to both the Fred Hutch and others here, and the University of Washington as well. And I think someone asked before, I think there was a question in the chat is, what was it that made it different here? One of the key things was we as a region really believe in science. And so the leaders could lead, but it wasn't going to work unless people followed. And so I think not just having leaders listen to science, but having a community in a region that really was steeped themselves in believing in learning and science really helped on that front. So I think having those relationships were important, but also making sure that as you progressed as a leader through all your decisions, that you were basing it on solid data and science. As Mike Bloomberg used to say, if you can't measure it, you can't manage it. And I think that that's steeped into mayors, particularly across not just America, but across the globe. And so having the relationships were key. I'll also say, and I hope we get to talk about it, is the relationships we're able to build across borders, so mayor to mayor, was critical, and across frontiers in other countries. I was able to sit on the governing board of the C40 mayors, which is the international climate group. But we created a COVID recovery response that included mayors from each of the continents to be talking about how do we recover and how do we look out for each other. So I think that we need not just a national response, we need to have a more vibrant, connected international response.
Thanks. I think related to that, let me ask Dr. Lurie, you described what might have been at the national level if, for example, the Obama playbook that was well developed had been followed. At the same time, the actual authorities for public health are all state and local. The national role is almost completely advisory, at least when you go by what the statutes say. Is this an impediment for where we should be going in the future?
It's a great question. We live in a federalist society. I think we have seen that. And I think we've seen times like we did in COVID, where states and locals all went their own way or had to go their own way. But I think the reason for that was really absent federal leadership and guidance more than anything else. I don't know that federalizing all of public health is going to be either constitutional or going to be viable. But I do think, particularly as our data science has evolved and trade and travel and border crossing has evolved, thinking much more about how to defragment public health and what sorts of things need to happen at a federal level, particularly with just-in-time data sharing. It's really, really important. I think in past crises, we've seen lots of examples of where federal leadership providing guidance and information has taken us a really, really long way. And then it's often the publics and communities who say, well, why aren't you following the federal guidance, or why do things look so different here? So you want to have those degrees of freedom. We've also got a bit of a situation, I think, because so much state funding comes from public health funding comes from CDC, and yet the data sharing isn't terribly bi-directional right now. I think we have a situation where it's really hard for states to challenge CDC. And so I think really rethinking some of those relationships, super important. And also, as I said, some of the data sharing, it's crazy that data has to go from a local level to a state level, all get massaged and analyzed, and then go in a really fragmented way to a federal level. As you know, I think Dr. Meyers said, or Dr. Rivers said, outbreaks happen all the time. We miss them all the time because we don't have good data systems and good communication that integrates across the federal, state, and local levels. So yeah, we can do much better, but we're going to have to do it in the context of the Constitution and federalism.
Yeah, you've raised data sharing, which is a very interesting question. I bet everybody on the screen has some view on that. I wonder if some other panelists would like to chime in on how the data flows or doesn't flow now, and what should we do about it?
I'd like to see a big push towards making data, public health data in particular, open and available. Although I think greasing the wheels between the various levels of public health in terms of data sharing is critical. There are a lot of stakeholders who would like to make decisions based on that data who are not in that circle. There are often community groups, non-governmental organizations, elected leaders who are not connected to that system, who would benefit a lot from being able to better understand what's happening in their communities. And so I think the closer we can get to a kind of Census Bureau model where there are well-defined standards for how and when and at what level data should be released, the more stakeholders I think could really benefit from that data.
Mayor Durkan, were you concerned with data either flowing in or flowing out to help the national picture?
It was one of our biggest challenges at the beginning of COVID. I mean, we had, not only did we not have the testing data, but we saw quickly that, public health is a pretty narrow pipe and is pretty self-insulated. And so the data going in and out of that pipe was not being able to scale to what we needed. And it wasn't connected to things like our hospital system. The beginning, we did not know the capability of our hospital system in the region. How many beds were there? How many ventilators? What was their usage? And so we quickly built up working with the state, and we were lucky because we had Microsoft, Amazon, who lent us, engineers to build quickly a data system that would connect all of the hospitals so that we could see in real time where hospitals were stressed, what equipment they had, what PPE they had. I mean, and we were flying blind. We just knew we didn't have enough, but it was almost impossible to forecast how we're doing. So building that kind of capability, I think, is critical going forward. And people got to get out of the way. There's got to be less turf and more sharing, because you just see people were so used to just sharing in their own space with their people, and they could always find rules and regulations and privacy things that would prevent us from really having a holistic look. And so I think we really have to learn those lessons and realize that when a pandemic hits, there's such a range of data you need immediately, from the failure of businesses to whether it's hitting our Black and communities of color harder. How do we get age groups, demographies, where parts of the state. So I think that we used kind of old world systems for a new world pandemic, and we've got to catch up.
I'd love to share Austin's experience with data. I think it's instructive as well. So early on, I think very much like Mayor Durkan was explaining, Austin had a lot of crappy data and was trying to figure out basically what should we be tracking, what should we, how do we know when to act basically. And one of the contributions the scientists made was to look at the data that were available sort of very rigorously and say, try to say which ones of these data sources is giving us a signal of where and how it's spreading in the city, and what's missing that we can very quickly try to access. And what came out of that was an analysis that suggested that the very best thing we could do on the fly was try to get all of our local hospital systems to report on a daily basis COVID-19 admissions. So how many people were newly admitted to the hospital? And that turned out to be a more reliable signal than cases, positivity, total number of hospitalizations, total ICUs, mortality, just for a variety of reasons. And so again, sort of a stroke of leadership, the mayor, the public health authority, the county judge, they collectively asked the hospitals to start providing this. And they've been providing it for almost a year now. Every day we get this feed, and that has really helped with situational awareness. And as we think about kind of building a national data resource, I think there's a few things we need to keep in mind. One is, besides all the data that has proved useful that we've had a hard time getting access to in COVID, I think it's really important that we approach it through socioeconomic, racial, ethnic, equity lens. Even though we've seen a lot of data and more data, we still don't have a good handle on data that reflects disparities in real time and allows us to address those gaps. The other thing we need to think about is, in addition to having the data, we need to have the analytics and the translation so people understand what the data is telling them. Many people still think that when you move into these like upticks in the pandemic, that things are going to grow linearly. And they don't realize that they have to take action at the first hint of an uptick, right? It's just sort of this exponential growth. And so just having the basic analytics, the understanding, so that we can make sensible decisions when the data do become available.
So, you're reminding me of a couple of other really important points that I think would be good for us to talk about. One is, I've been really stunned when I look around the world at countries that have real organized health systems where everybody is in and the data's all in, how well they've been able to manage critical aspects of their response. And so if I look at a place like the UK or Israel or other places, they're able to use their health system to get pretty close to real-time data about the epidemiology around the country, that they've been able to use it in clinical trials to test all sorts of things. They've been able to use it in a diagnostic sense. They've been able to use it to execute a vaccine program. They've been able to use it rapidly to look at vaccine safety and real-world data and vaccine effectiveness. Our healthcare system, first of all, is so fragmented that we right now don't have the ability to do that. And because it and public health data usually travel on parallel tracks, never to meet, we don't have the ability, except in cities where there's really terrific leadership, like we've just heard about in Austin and Seattle, to make that happen on a local level. We're missing a national picture. And then if I go to the national level, to a place like CDC, and I think about all the people there in all the tools, we still have human beings analyzing most of this data over time, when right now everybody's drowning in data. And there are, new tools that have been developed through data analysts and data technology that could help a lot. And so save the humans for the real interpretation of data once a signal is detected, by a machine or machine learning or other kinds of ways. So it's also time to both integrate and modernize our systems.
Thanks. Let me change the subject a little bit. Caitlin described a proposal that she had published on previously in academic settings before the Biden administration picked it up, for something like a national weather service for epidemiology. We're coming out of, we hope, we're in a crisis where there hasn't been such a professional service within government. Instead, there's been a kind of a self-organizing volunteer effort of research scientists. So particularly looking at Dr. Rivers and Dr. Meyers, is there a tension here? Can we have both a vibrant research establishment and an effective in-government establishment, or would they inevitably be in conflict?
Yeah, this idea has actually been percolating in the academic community for years. And so I think it's the academics themselves who see an enormous need for this. And I think that elected leaders and public health officials see the need too. What academics are really good at is advancing the state of the science, developing new methods, new data sources, really pushing the frontiers. What I think government is better at is doing the operations, really turning the gears, getting it into the hands of people who need to make decisions. So sitting with the decision maker as they go through the discussion. And so I think there's room for all of that expertise to be brought to bear. Right now, it's all being kind of shoehorned into academia. It's very difficult to build and fund an academic research program with operational support. And so I think that's where we need to grow what we're doing and move some of those functions into government, supported by academics who will really break that new ground for us.
Do other panelists agree with that?
I certainly agree with that. And I mean, I would say most of us got into this field because we want to do science that makes a difference. And the most frustrating thing is when we do good science, maybe it makes an impact on a local scale or not, and there's no way to sort of get it out to be so that it makes a difference, so that it, you know, advances public health and saves lives on a national or global scale. And so I think a, you know, robust government infrastructure to support our kind of science, but then help us translate it into applications in the real world is absolutely vital going forward.
Yeah, I would echo that. And I think that it's, you know, tying some of the previous questions together. It's great to have CDC say, here should be the standards, but if you don't have a way to get that down to the community level, then it's not going to work. But we got early in this pandemic, I think it was one of the greatest challenges was not just how do we solve the problem in front of us, which was just so significant and unprecedented, but what's coming next? You know, what is that forecast of what's coming next? You know, I was really fortunate. Not only did I have great local researchers here, but I was able to tap into some of the Obama people like Dylan George and Beth Cameron and Rebecca Katz and Jeremy Konindick. And I could ask them, okay, what's my next worry? Because I got to start worrying about that now. And so building that kind of vibrant infrastructure of having that modeling and having people that can say, not just here's the problem you have today, but here's the next 5 problems. So as you make this decision, setting yourself up for the next 3, I think is so critical. And I think going back to that last statement is so true is we have to do it not just on a national level, we've got to have better connectivity again on a global level, because we have this pandemic because we didn't have that. And so I think whatever we model in America, we have to remember we have to stay connected to the rest of the globe.
And that also means not only human health data, but that whole field of animal health data, spillover, predictions, and analytic capability and modeling there, so that we really can do a much better job anticipating what's going to happen.
I'll just add one more point to that. It's, you know, the human, the animal, but what we've learned in COVID is that this is not just about the epidemiology and the biology. It's about the society. It's about educational data, housing data, you know, all of these sort of complex interdependencies. We need to be tracking them. We need to be mitigating the collateral harms that are happening throughout our society.
Totally.
Well, we have less than 2 minutes left, but there's a very interesting, almost philosophical question that has come to us from one of our viewers who says, what can an ordinary person do other than passively follow orders? Are ideas, imaginations, ambitions, and motivations of the 6 billion non-scientists all useless? Must this all be in government hands? Anybody want to have a stab at that in 1 minute?
I think that comes back to a point I made briefly in my remarks, that when we set out with weather forecasting, we had a fairly narrow idea of how we might use those forecasts. And it wasn't until forecasting became routine that we found a whole suite of uses for it. And like how we've been describing disease forecasts, originally weather forecasts were more at the corporate level or the federal level. And as they got better, it moved into the hands of individuals, and individuals became empowered to make decisions off of that data. And I would love to be able to grow into that with disease forecasting. So you might reach for a mask if the forecast in your area looks poor, or you might cancel your gathering. I could really see that becoming part of our everyday lives. I don't think we're there yet, but I think we could get there.
On the other end of that, I think this whole area of citizen science is really exploding. And it sort of links to this question about what can and do ordinary citizens do. Often they're the ones that get us the early signals about what's going on right now, right? And I think, again, bi-directionally with scientists, with data scientists, with others, asking the questions, having citizens around the world provide us eyes, ears, information, and then synthesizing it and feeding it back in the ways that Caitlin just talked about are just so critical.
And I think that the, ordinary residents and citizens, they don't just follow, they follow what they believe in. And so having the education and the information and transparency is so critical, because look, no city did well if people weren't willing to take the steps they needed to give up their job, to wear a mask, to keep physical distance, to not see the people they love. All of those were individual actions. And at the end of the day, it is only those individual actions that were our defense against this virus.
I think that's a great point to end on. We're just at the end of our time, so let me warmly thank all four of the panelists. I think we had a great discussion. Let me urge people who have watched the panel discussion to click through to watch the pre-recorded segments that each of the four panelists have done. I found those all fascinating. And with that, I guess we'll adjourn this panel. There's a short break, and then the third panel on the vaccination response, the vaccine development and vaccination response will be starting. Thank you all.
Thank you.